Diseases should make us feel solidarity because they know no borders. And this is the moment to show solidarity with the rest of the world.
I am Jen Lotito, President and COO of RED, and I'm thrilled to be bringing the next edition of RED Talks, this time here at the UN General Assembly Week in New York City. I am so happy to be joined by Dr. Allan Pamba from Roche, as well as Serah Makka from the One Campaign. Welcome both to New York City. Allan, can you talk just briefly about your role at Roche?
I lead Roche Diagnostics in Africa out of Nairobi, Kenya. My role is to drive our strategy in Africa. Essentially, we are driving a strategy we call 10X. We want to reach 500 million Africans with quality diagnostics. We used to reach 50 million in 2021, and the goal is to reach 500 million people.
So from 50 million to 500 million, that is an aggressive goal.
Roche has a long-standing presence in Africa, obviously, and a real focus on supporting countries' healthcare goals and increasing access to care. How has Roche's presence evolved over time, and how will you continue to innovate at Roche?
We are working with the objective of supporting the achievement of universal health coverage in Africa, so health for everyone in the continent. Over the last many years, we've grown our presence. We are now present in 40 countries. We have literally doubled the size of our team in the continent in the last 3 years, and we've made significant investments in supply chains into the continent.
Can you talk a little bit from your perspective about why investing in healthy communities is also an investment in that economic competence?
You know, Jen, I really believe any country's biggest asset are its people. Invest in your human capital, education and health, and that will pay off. Most people don't realize that it's an incredibly young continent. It's 1.4 million people with an average age of about 20 years. By the year 2050, Africa will contribute 25% of the global workforce. We want to make sure we are ready. We want to make sure that they have the right skill sets that they need, and we want to make sure that they are healthy. And I truly believe that will be a huge economic advantage to the continent.
Thank you, Allan. Serah, I'd like to turn it over to you, my colleague at the One Campaign.
One Campaign, as you know well, Jen, is an advocacy and campaigning organization, and I'm the Africa Executive Director. What that means is I'm responsible for driving development finance, creating the strategies and the advocacy paths within Africa. Sometimes development finance feels like it's about a balance sheet. It's actually not. It's about countries' ability to develop themselves. So our work is, how do we ensure we drive the right kind of financing to these countries? How do we ensure that it's being shaped by Africans as opposed to what the West thinks Africa wants?
When you look at where the world is going and the cuts that are happening, we have to be innovative, right? We have to think in different ways. What does advocacy in action look like today?
One was already thinking about Africa's health sovereignty. Post-COVID, there was a very stark picture of where Africa was at the back of the line. I don't think Africa will ever forget that moment. So the question is, how do we ensure we never get back to that place? Sovereignty is not you don't need others. It just means you can develop enough within yourself to sustain in times of adverse moments. 800 million Africans will go into the workforce by 2050. 800 million. What are they going to do? Health has been seen as an expense for many countries, but it can be an investment that can mop up unemployment through the health system. It's not just infrastructure, it's not just manufacturing, but the health system can be an active player. Where are the returns for Africa rather than the risks in Africa? At the end of the day, that's what we want to see.
That's how this is all going to work. And you think about companies like Roche who are investing in those countries and the economies. I mean, it all has to work together. You know, RED and One were co-founded by Bono and Bobby Shriver, with RED being focused on the private sector, One clearly being focused on the public sector and the governments of the world. But when we think about this collectively, how do you see, Serah, the role of public-private partnerships? How have they changed over time, and are they still critical to these sustainable programs?
I think now the private sector's role is increasingly important. When we see governments really struggling with domestic resources mobilized, we see ODA coming down. The next kind of leg of that stool is the private sector. And now more than ever, the private sector is more important. The investments are very important, obviously. For every single innovative financing mechanism we have, there is a private sector element to it. The public sector still has a role as setting the rules for how this whole thing engages.
We are here, like I mentioned, at the UN General Assembly. Last night, the Gates Foundation made their pledge to the Global Fund. RED made our pledge to the Global Fund for the next 3 years. Why is now the time for bold investment in the Global Fund?
Now is the time to lean in. It's not a charity, it's strategic actually.
Yeah.
You know, if you think about it, we've had massive gains, Jen, over the last years, which people now forget. I saw the worst of HIV/AIDS as a young physician. I saw the worst of malaria as a child growing up in Africa, where 1 million kids will die every year. We don't have that anymore. The numbers have come down significantly in terms of new infections or even deaths. That could go away like that if we take our foot off the pedal. And as we know, diseases do not know any boundaries. You know, you have a health threat anywhere in the corner of the world today. It's a health threat everywhere in the world.
Diseases should make us feel solidarity because they know no borders, right? And this is the moment to show solidarity with the rest of the world. And we've seen funds reduced from many places. Global Fund is one we want to see upheld. Kind of moving from a disease lens and more to a systems lens. The system should be able to take care of us. How do we ensure more sovereignty of health in Africa?
Health sovereignty for Africa should not replace global solidarity for health.
Correct.
When I reflect on the journey we as a company have done in Africa, tremendous success in the area of HIV/AIDS. You know, we serve about 50% of HIV patients in Africa with the viral load testing with early infant diagnosis. We couldn't have done it without partnerships, and I'm very proud to say our partnership with RED and Big One have been critical for that success. And it's the bedrock of the bigger ambition we've built in the continent, you know, to reach 500 million people.
In this new world that we're looking at, we have to focus. That's the only way this is all going to work, right?
Absolutely.
Is all of us coming together and uniting around the need for this. This has been amazing. I heard a lot about health sovereignty, the sovereignty of the continent, and it's certainly public-private partnerships are the way we're going to get there. So I want to thank you both for being here, and I want to thank you both for being part of Red Talks.
Thank you very
Thanks,
much.
Jen.
All right, thank you.